Good afternoon, all. We will get started in a minute. We are just waiting for people to log on. So we're just going to give it a few more minutes. Again, good afternoon. We're just going to give it another minute or two as I see more people are logging on. So if you will just bear with us, we will shortly get started. Okay, so we will get started. I know some people told me they're going to have to join a little late. So just very quickly, introduction-wise, my name is Mark Graham. I'm the Vice President of Program Services here at Coordinated Behavioral Care. And it's a pleasure on my part to be able to present this town hall session today. Those of you who've attended before, you will know that we have been running these town halls since the beginning of the year. They came about as a result of some of our member agencies approaching us and feeling that their staff had questions and they really wanted a forum where they could put those questions to sort of a panel of experts. And we've been fortunate to have two experts join us, and this is our fourth session, and it's a real pleasure to invite back Dr. Trivedi and also Brad Hutton, who are going to spend some time with us today, focus on some three particular areas. One area is around gathering, and now that a lot of people are getting vaccinated, there's a lot of questions as the warmer weather it starts about how safe it is to gather with family and friends. Now, the second is obviously an area that's close to my heart of travel. A lot of us have been sort of homebound for the last 16 months or 14 months at this stage. And so there's a lot of questions about how safe travel is. And then finally, an area that we've been asked questions about is around dating. And so our focus today is going to be over those three areas. But before that, I'd like to welcome back Dr. Trivedi and Brad and to hear from them a little bit of a status update in relation to COVID-19 across the US and obviously particularly here in New York State. I think it's always very helpful to sort of put things into context of where we stand as a nation fighting this pandemic. So welcome. Thanks for joining us.
Thanks for having us. Mark, I'll start the presentation today by just giving that epidemiologic overview. Share my screen here. So this is a curve that shows the total number of cases of COVID by day in the United States since the beginning of the pandemic. And you can see our initial peak back in March or April when things were really bad really looks like a tiny hill compared to the big surge that we saw after the holidays of in December, January. And while fortunately we have reduced back down, we're still remaining as a country at a daily level of cases that's concerning, 60,000 cases a day or more. And, just for those who haven't been watching what's happening globally, there are other countries that are experiencing the worst surge that they've seen to date. The situation in Brazil and India, and even countries in Europe like Germany and Sweden, where ICUs are at capacity and they're seeing variant strains that are causing surges. And even within the US, we have some states like Michigan and Minnesota that are experiencing really concerning surges I don't think we quite understand the reason for some of the regional differences across the US, whether there's seasonality or introduction of variants that sort of spike surges. But, we're definitely concerned. And I don't think we'll get comfortable until we get down to a much lower level. New York City, similar trend, except you can really see that March or April peak from 2020. And you can see that actually the holiday surge that we experienced actually was higher as far as total cases. The deaths were not as much. And we're still, we had a little bit of a surge there in March that's receded. But I think until we get down to that daily case count that's below 500 cases per day, I don't know that we should feel comfortable like it's over, because at this point, it definitely does not appear to be. Some summary statistics of the situation in the US. We now have more than 31 million cases that have been reported. There's certainly probably twice that have not been reported or documented. Deaths, we are climbing steadily towards 600,000 deaths in the US. On the good news front, we're making tremendous progress with vaccination. 40% of the country has now received one dose of a vaccine. Now this is for those that are two dose series. More than 25% are fully vaccinated. And you can see some of the population that we really focused on as being the initial priority, older adults 65 and older. We have 65% or more are fully vaccinated. And so we're really making tremendous progress. And this curve really shows that. There was a time when we were celebrating vaccinating 1 million people per day and then 2 million. And now, before last week, when we put a pause on the J&J vaccine, which Dr. Trivedi will talk about at some point when that comes up, we had peaked, so we were delivering more than 4 million doses a day. And while we had a little bit of a setback, we're still at about 3 million doses a day. And so it is exciting to see that percentage of the population who are fully vaccinated continue to grow, but we still have lots of challenges ahead. I think I'll pause there.
Yeah, I'm going to get to the, hold on, did I? Oh, I thought I lost you there for a second. But it's very interesting, and I always find your initial slides very sort of sobering in many ways. Just one, obviously, given the high death rate within the US. And then also, it remains sort of an enigma and a puzzle, just why, as you say, places like Michigan have these spikes. But there is elements of optimism in the air. And I know last time around we talked about vaccines and stuff, and we've seen those numbers of individuals getting vaccinated. And to me, that's really promising. But it did feel like a little bit of a setback with the J&J. And again, as a non-doctor, I have friends who have been very hesitant, and it's almost like it reinforces their hesitancy. Would you be able to speak just a little bit? Like, I know it's not one of our major topics, but just, I think it's important just to address a little bit some concerns about J&J, and if people have got it, should they be even more concerned?
Sure. Brad, can we go to the harm reduction slide just to talk a little bit about harm reduction? Because I think that is a good way to set up our discussion today around not only dating, traveling, and gathering, but also how we look at the J&J vaccine and the pause in the J&J vaccine. So harm reduction refers to interventions aimed at reducing the negative effects of health behaviors without eliminating the problematic health behaviors completely or permanently. And certainly all of you on the call who engage in mental health and behavioral health activities truly understand this principle about harm reduction. This is what we're trying to achieve. And we've successfully applied these principles to hepatitis and HIV, certainly around using condoms when you're HIV positive, substance abuse, tobacco use, sex work, and many other public health challenges, understanding that some of these behaviors we don't or won't be able to shut down completely. So it's important to apply harm reduction to COVID-19, acknowledging that certain higher risk behaviors such as dating, gathering, and traveling are not likely to be eliminated, but can be modified in a way so that the risk is lower or reduced. So let's actually then skip Brad, over to the vaccine slides. I think we have a section about vaccines here. Yeah, the latest issues on vaccines. So on April 14th, the CDC convened their expert committee, the ACIP, to review reports of cases of this rare type of blood clot. So this blood clot that we're talking about is called cerebral venous sinus thrombosis, which is a clot that occurs in the brain. And what they saw is anywhere between 6 days and 13 days, individuals were presenting with this rare blood clot. And unfortunately, in one of those cases, the vaccine recipient ended up passing away from this complication. So far, 6 cases have been reported among nearly 7 million individuals vaccinated with the J&J vaccine. And so if you look at kind of all comers, so everyone who got the vaccine, it's really 1 in 1 million in terms of the chances of having this rare blood clot. Well, we also note as we've delved into the epidemiologic side of these cases is most, all of these cases are women between the ages of 18 and 48. Yeah, they were all women. So that's another thing to understand. And that also fits very consistently with the AstraZeneca vaccine that's been being given in Europe, and also finding some similar clotting complications there as well. So the reason I wanted to talk about harm reduction in the context of talking about J&J is just that we have to understand that this risk is very, very, very low, 1 in 1 million. Just as a comparison, oral contraceptives, right, birth control pills that many women take have been associated with increased risks of clotting on their own, actually a little bit higher of a risk with 1 in 10,000 people experiencing a clotting complication. And then remember, COVID-19 itself carries a risk of blood clotting. In one study at the University of Oxford that we highlight here, the risk of blood clots was actually 10 times higher among people infected with COVID-19. So remember, although it does appear that the J&J vaccine does confer this very rare clotting complication, just having COVID-19 itself also increases your risk of blood clots. So we are awaiting a decision by ACIP later this week. I believe they're meeting on Friday to convene and look at all of these cases of this cerebral venous sinus thrombosis. And then likely what we will see is a resuming administration of the J&J vaccine, but also saying that maybe women under the age of 50 should be prioritized with either the Pfizer vaccine or the Moderna vaccine. It doesn't appear that this clotting complication is really worrisome for older adults or men over the age of 50. So
I was just going to say, I think it was on NPR, I heard that this sort of type thing, like a pause, is normal with a lot of medications and things that roll out, that this isn't just unique because it's a fast processed vaccination, that there is a normality to this too.
Absolutely. So, when there are serious complications that occur once we deliver any treatment, any vaccination in the larger population, there is this very rigorous vaccine safety monitoring program that ensures if there are complications that were reported that are considered to be related to the vaccine or the treatment, then the vaccine or the treatment can be paused. So I think you mentioned, Mark, that some people are certainly worried about this pause, and it's giving a little bit of credibility maybe to people that said that, oh wow, this vaccine was pushed out so quickly. But I think that the other way to look at it is that this pause shows us that the safety monitoring programs we have in place are robust and are working. And so the US government wouldn't allow a vaccine that had this very, serious complication to be out on the market unless we understood what the rate was and what the risk was. But I do want people to understand that the risk is very, very low, and really should be taken into account with all the other risks we take, every single day. So I know it's a new risk for people, so that can be something that is concerning, but I certainly think in older adults and men over the age of 50, there should be no problem with getting the J&J vaccine. It's still very effective at preventing serious disease with COVID-19, hospitalization, and death.
But and just with that though, is like if it rolls back on the market, say Saturday, if I have not been vaccinated and say I'm not a woman in that age group and stuff for priority for another, can I choose not to have J&J? Like if I'm registering for vaccination, can I say, hey, I only want Pfizer or Moderna?
Well, I think that there are websites now that you can go to and they reveal which vaccine is going to be available at the appointment that you're making. And I also think that unfortunately we're getting to the point where there are more vaccinations maybe available in certain places and there are arms available for the vaccinations. So although I think that there are ways, if you want to get a certain vaccine, I think that there are ways for you to figure out which vaccine is going to be available to you. I would still encourage everyone to understand, based on what Brad presented at the beginning, we're still not out of the pandemic. We are still seeing deaths and hospitalizations. So, we encourage people to get vaccinated. And if you feel like the J&J vaccine is not the right vaccine for you, then I think that probably in your area now, the Pfizer or Moderna vaccine would be available if you looked for it. Brad, would you agree with that?
Yeah, I mean, I think that the J&J vaccine is going to continue to be a really important tool in our battle against the pandemic. And I would encourage people to get the first one that's available to them. But if you have the ability to get one that you're more comfortable with, and it's the Pfizer Moderna one, then by all means.
I would just add, I think just for our workforce as well, if you do work with individuals, that it may be difficult getting them to 2 appointments. That getting the one J&J, it's real advantageous. People with mobility issues, perhaps someone who's homeless or difficult to locate and stuff, that you don't have to try and track them down for a second too.
Absolutely. I think there actually are a lot of people that are leaning towards the J&J vaccine for the reasons that you mentioned. And I think this pause should not deter people from believing the J&J vaccine still will protect them from COVID-19, which it certainly still will.
And so following with this, because we're going to talk about Moderna and Pfizer, someone asked me a question this week and I honestly didn't know the answer. They say, like, when you get those vaccinations, the second dose, 10 days later, you're 96% what? Like you're 96%, so 4% chance of getting COVID, or if you get COVID, you're 96% likely not to go to the hospital. It won't be serious. Is it, do you know what I mean? Like I'm trying to sort of work out like what that percentage is like, and I think it leads to all of these topics we talk about today about being vaccinated.
Right. So the first thing to mention is this slide here that Brad pulled up, that the different vaccines convey a slightly different efficacy rates. But if you look at, again, severe disease, hospitalization, and death across all of the vaccines, even the AstraZeneca vaccine, which is the one that's predominantly being given in outside of the US, you see that, the protection from severe disease is anywhere between 85 to 100%. And then 100% essentially for hospitalizations and deaths. So you don't have to worry about that protection. When we talk about the 94, 95% efficacy, the 72% efficacy with the J&J vaccine, we're really talking about milder disease. We're talking about the efficacy around milder disease. And I think, Brad, if you go to the slide just before this, I think I have, this one right here. So what that percentage means, Mark, is not that 95% of the people who get the Pfizer vaccine are protected from mild illness and 5% get it. It actually doesn't mean that. It means that instead of 1,000 COVID-19 cases in a population of 100,000 without the vaccine, we would actually expect cases to be down at 50, meaning that there's a 95% reduction in risk, such that 99.95% of the population is disease free, at least for 3 months. So it really truly is that we're reducing risk so significantly that we are almost eliminating the possibility of having mild infection at all.
That's great. And indeed, just before we get into gatherings, because I do want to get to our topics today, there was a question that came in from someone actually just yesterday in relation to clients and staff at a center, say like a clubhouse. What percentage need to be vaccinated in order for like there to be a micro herd immunity? And is it possible when you, without asking everyone their stats, and there's confidentiality around that too, and judgment and stuff. So just before we move on, any thoughts?
Yeah, sure. And I think some of this data is really coming out of Israel, given that Israel has done such a good job with vaccinating their populations. But what we're seeing there is after they reached about 60% of the population being vaccinated, we're really seeing a serious drop in the number of infections and the number of hospitalizations. So, it truly is showing us that potentially herd immunity might be lower than 75%, which is the number that we have been throwing around. And then I think as we move along in the pandemic, we will see, and we already are seeing, certain states that are more likely to vaccinate. Unfortunately, we're seeing this division between red states and blue states, where red states are less likely to, people in red states are less likely to be vaccinated than people in blue states are. So we probably will end up with communities where people are highly vaccinated, 60, 70%, where you could say you've attained herd immunity, and in other communities where vaccination rates won't be as high. And so we'll have to see what that looks like across the country. But I certainly think that, like, for example, if your extended family is most people in that group are vaccinated, right? All the adults and all the grandparents, and maybe the kids are still not vaccinated, that would feel like a really good environment for everyone to take their masks off in a space together, because you've achieved herd immunity in that small group, right? So yeah, I think that idea of micro herd immunity is really something to talk about, because I think it will be something that comes up later in the pandemic as we move along and see how we do with vaccinations.
Right. And just as we move over into the gathering, I just want to encourage people to put comments and questions in the box. There is a comment there just regarding to efficacy, that it is, and I believe this is right at the moment, it relates to trial participants, people who participated in the trial, those figures, but we're probably obviously learning more, as you say, from Israel and other countries, and here in the US now, as more people are vaccinated. That would be my correct assumption?
Yeah, so efficacy does, as the attendee notes, does refer to protection within the context of a clinical trial, and effectiveness is the word we use when we look at the real world, when we look at a real world population. So I hope you guys can hear me.
Yeah, no, I hear you.
Okay, so it is true. We use the word efficacy, but we are starting to use effectiveness because of places like Israel, where we are seeing still 90%, 92% effectiveness rates when we look across, large populations in Israel. So we are finding that the effectiveness is very similar to the efficacy that we saw in the clinical trials.
And the other question, and I'm not going to necessarily ask for an answer now, because I think as we talk through travel and stuff, it's an important one. And maybe Chloe, who's in the back room with me, can make a note, but it's around boosters and to get into a stage of when we need boosters, because as we talk about gatherings and safe havens, like I've been vaccinated, but at what stage is it going to wear off? But before we'll come back to that, but just again, put your questions in. I'm going to start in the area of travel, because it's something I love. And spring break just came for a lot of people. Summer vacations are coming up. People have been hibernating. People probably have a lot of backed up vacation time. And so a question that came in during the week was, even with vaccination and being fully vaccinated, is it ethical and responsible to travel on a vacation? It's a really good question.
So yeah, I mean, I think we're all itching to make summer plans, and while we're guardedly optimistic that the summer could be different, that there is still a surge, and so I think we definitely have some recommendations and suggestions to share, and let me just talk a little bit about travel. First of all, based on recommendations that the Centers for Disease Control offered now about 2-3 weeks ago, we do think that there's a difference as far as the level of risk for people who are fully vaccinated. And CDC now says that fully vaccinated people can travel within the United States, and they don't need to test or self-quarantine as long as they continue to take precautions while traveling. Wear a mask, you still need to avoid crowds and be distanced from others and wash your hands frequently. But it's this emerging variants of concern that I think really still have us being cautious about travel. Travel helps facilitate the spread of variants. And so even domestically, obviously travel to Michigan could potentially result in propagation of those variant strains in Michigan getting to other areas. Fully vaccinated people can travel internationally as well without getting a test before travel, unless it's required by the destination. And CDC no longer, if you're fully vaccinated, requires you to self-quarantine after returning to the US, unless that's a requirement in your state. However, you still need to get a negative COVID test result before you board the flight to the United States. And that's primarily because there is this prospect that over time, variant strains could begin to evade your immune protection through vaccination. So
Can I just ask, Brad, sorry, just to I don't mean to be rude, but when you say that sort of coming back 3 to 5 days later doing another COVID test and stuff, there isn't any other than a recommendation, correct? Like, so if I come back, who knows? Like, it's up for me to almost self-dispose, for me to take those steps. No one is requiring me to do it, correct? There's no hotels to be quarantined in until you get the negative test.
I think you'll find upon return that it is a requirement that you need to demonstrate that when you're re-entering the US. At this point, whether that changes from a requirement to recommendation, we'll see. But I think at this point,
okay,
there is still a need to demonstrate a negative COVID test result. And actually, I think the airlines will work to make sure that you have that.
Okay. Sorry, I just wanted to get that in there before.
Yeah, no. So if you're unvaccinated, however, and obviously this is a big plug for the need to get vaccinated, CDC discourages only essential domestic travel, discourages all non-essential travel if you're not fully vaccinated. And if you, despite that recommendation, travel and you're not vaccinated, you should definitely get tested 1 to 3 days before, and then 3 to 5 days after. And then you should stay home and self-quarantine for 7 days after travel. There's the risk that by traveling without being protected, that you will become infected and import that disease to your home community. And so the testing and quarantine period really limits that from happening and reduces that spread of variant strains from region to region. And so, first recommendation is get vaccinated. And the second is, really discourage you from travel if you're not. But, we definitely, as Kavita said at the outset, are proponents of harm reduction. And we understand that a lot of people who are not vaccinated are going to travel. I mean, I think situations dictate that. So just some thoughts on ways to reduce risk. Definitely consider traveling by car. If you're not protected, avoid those, avoid airplanes, avoid crowded airports and crowds in general. And you can control that more if you're in your own private vehicle. Certainly you could consider public transportation, that's possible. But that would be a situation where we definitely would recommend that you wear a mask, make sure it's well-fitting, it's highly protective. We definitely have some recommendations we've covered in the past and can share again about the types of masks that offer the best protection, including maybe even double masks. Consider adding a face shield if you can't stay 6 feet away from other people. and obviously keep hand sanitizer present so you can constantly have good hand hygiene.
Before you jump on, can I just interrupt again? I'm sorry because one of the questions we had was in relation to someone planning a trip to Florida. And there was that question of like, is it safer to fly or drive? And I've heard that flying actually was safer. And part of the reason, maybe it's the airline's promotion of their ventilation systems, but driving a long distance like New York to Florida requires hotel stays, food stops, pit stops, gas stations, and there's actually almost more risk of exposure. I just wondered if you had thoughts on that.
I think it depends on your ability to isolate yourself and your family. You know, I know if I was driving to Florida, I would be choosing hotels where I didn't have any interaction with other people. I would be avoiding crowded rest areas and finding other ways to get food so that I could remain socially distanced. So I think if you can do that, driving by private vehicle potentially offers you a safer way to travel. If you can't, then it, you know, maybe it is a decision about whether a short air flight is better than a longer drive. You know, so more information on airplane travel, which I think is helpful. That, you know, CDC here in the last couple of weeks published an interesting study with some colleagues at Kansas State, and they actually found, you know, exposure was reduced when the middle seat was kept vacant. Some of the air carriers doing this, you know, it might be something you want to ask about. It obviously just reinforces social distancing. And when we look at people who've been infected who flew, the individuals, the passengers who were at greatest risk were those who were seated within 2 rows. So obviously an individual in close proximity. So when you fly, avoid crowded flights. You want to maximize that your ability to be 6 feet from others. You know, really do what you can to wear masks. Again, another setting where you could potentially consider double masks or a face shield. And you know, just do your best to avoid that travel if you're not vaccinated.
With that sort of travel side of it, to take it on, like sort of vaccinated, non-vaccinated, and I feel like there's almost at some stage going to be like a divide, and you know, asking questions. But there's been this talk of vaccine passports, and like, and I've heard it in Europe, and I've heard it here. Is it something that you think ultimately we'll be able to enforce, and that would make it safer for all? But does it punish people then who haven't been who choose not to, for whatever reason, not to get vaccinated?
Maybe I'll start, and then Kavita, if you want to jump in. Yes, I think we're seeing evidence in Israel where they use a vaccine certificate. The European Union has made very clear they're moving in that direction. The federal government under the current administration has really said that they are looking to the private sector to develop this. And I think you're going to see arts and entertainment venues, you're going to see travel carriers really push this concept of creating the technology to allow us to have a credible source of information and to have venues where there's increased capacity and less distancing, and maybe foregoing mask use when you have people who can demonstrate they're either fully vaccinated, have been recently infected, or have a negative test. You know, we're seeing this in New York with the Excelsior Passport program. And I think you're going to see private sector venues and establishments this summer really push the envelope in this area.
With that, in a way, and I'm sorry if you wanted to chime in too, it's probably going to sound like a dumb question, but like we all got those nice little cards when we got double vaccinated with our dates and stuff. Some of us aren't the best at keeping things like that. And if you've lost your card, that is your perhaps evidence, how do you go about getting it like acknowledged that you are vaccinated? Like, is it state by state? Is it even possible for them to track you? Any idea?
When you get vaccinated, in addition to them writing that card for you, there's always somebody there who's documenting that dose into the state immunization registry. You know, so if you've been at a large state vaccination center, you might have seen that somebody with a computer terminal, and certainly even in a pharmacy or other setting, it's always being documented in the immunization registry. So there's a digital record of your vaccination.
Yeah, I think I think that that highlights people should try to keep their card. And I've seen some people advocate for laminating your card so that it doesn't get smudged and doesn't get dirty, so that you can use it, you know, in addition to all the venues that Brad already mentioned, places like baseball games and you know, professional basketball game venues are all or many are saying that in order to come in to certain parts of the venue, you have to show that you've been vaccinated. So these cards will be, you know, useful, and people should try to keep them. And if you lose them, then you can try to get documentation from other means, like Brad mentioned. But I would highly recommend keeping it in a safe place.
Someone just put a nice, and I did not notice that Staples is nominating the CDC cards for free. That's really great. Great to know. Thank you for sharing that. As we don't currently have the sort of the vaccine passports, if you will, some very sort of practical questions then, like amusement parks. The moment they're not asking, like, so general guidance, are they safe?
You know, I think, you know, it depends. First of all, I would avoid a very large crowded venue. So, you know, we certainly don't want to be near large crowds. If it's outdoors, that might be safer than an indoor park. So, you know, if you have confidence that a Six Flags or another venue in your area, you're able to keep primarily outdoors in lines that are distanced, you know, that might be a good outdoor activity for the summer. And, you know, certainly would want to continue all those other precautions that we mentioned, like masking and hand hygiene, et cetera.
Is there more risk? So like, I have a 13-year-old. So people over at the moment, it's over 16, correct me if I'm wrong, that can get vaccinated. For those who are sort of like those teens, like, I think I'm more concerned for her almost. And I would consider some like amusement park almost high risk for her, not so much for myself. Would that be the consensus?
Well, we're not vaccinating children under the age of 16 yet. So I think they're certainly fueling the surges in some of these other states and with variant strains. Good news is that both Pfizer and Moderna have now found initial information from their clinical trials to suggest that the vaccine is actually even more efficacious among this adolescent age group. So I think we're likely to see this summer that will open up the eligibility criteria to include 11 to 15-year-olds, right, Kavita?
Mm-hmm. It's I think it's 12 to 15.
12 to 15, yep. Thanks.
Yeah. Cool. I only know that because I have a 12-year-old, so he qualifies.
I do too, so you'd think I would know that.
So to add, these two are going to combine together, because the amusement park is one thing where I feel like you can still wear a mask. But there's water parks and the beach. And the beach being, you know, you can spread out, but yet when you go into the water, everyone's right there. You know, people don't tend to go too far. And the hot days, it's going to be very crowded. But no mask. People are not wearing masks in these sort of water settings. So like, again, people are asking, like, you know, the safety, how safe are they?
Fortunately, we really haven't seen instances of transmission in aquatic settings and swimming pools. You know, and so that's good. But I agree with you. You know, it needs to be only if you're comfortable that you're able to be distanced. You know, even probably greater than 6 feet, because as you noted, people will not likely. We won't want you to wear masks in the water. So if you can maintain a distance that's even greater than 6 feet, again, it could be a good outdoor activity because we're just not seeing transmission in that setting.
Yeah, and I would just highlight, Mark, that, you know, two things. One, that outdoors, the risk is much lower than indoors. Any activity you're doing outdoors is much lower just because you have ventilation, a large amount of ventilation on your side to help with disseminating any viral droplets that happen to be in the environment. So, you know, I would definitely recommend outdoor activities over any indoor activities. And then the second thing I'd say too is that, you know, everyone should feel free to abort their plans if they feel that they are not safe, right? So if you end up going to a beach and you feel that there are lots of people that are really close together and not masking in that environment, then, you know, you should feel really okay with saying, all right, well, we're going to change our plans now because this just doesn't feel safe to us. And I think people should feel empowered to figure out where their own kind of, line is and not have to cross that. And I certainly would encourage people that are getting together. Well, we'll talk about this in gathering, but when you get together with other folks, everybody's, sense of, where their line is about what they're willing to do and not do is different. So you have to really be on the same page about that. And like I always talk about abort mission. You should just feel like you can abort the plan if things are not feeling safe for you.
I'm going to play devil's advocate because there's one place I feel like you can't abort if you're already on a cruise and you're out to sea. And I suppose you can go back to your bedroom and stuff like that. But the cruise industry, when this pandemic started, was something that was in the news a lot in the spread. And I know as an industry, it's been hit dramatically by, people are not going on a cruise. And someone did ask that, should we be saying I'm vaccinated, my partner's vaccinated, it's actually going to be safe? Or maybe there's going to be vaccine cruises, because I've heard of Greek islands that will only allow people in who've all been vaccinated. So I'm just wondering if you heard anything about sort of the cruise industry where you can't abort your trip midway?
I think you're right. Being fully vaccinated is a game changer. It is hard to quarantine on a cruise, though. Being confined to that really small quarters. I think that's what we learned when the pandemic hit. There were lots of cruises that were going on around the world, and we saw a lot of outbreaks on large ships because it was really difficult to avoid exposures. But as we reiterated with the CDC recommendations, if you're fully vaccinated, you really can consider travel a lot more freely.
There was a question that came in the chat that I think Kavita saw, and I think it's a really great question, that there are people who cannot take the vaccine for medical reasons and other reasons I think we've talked about in other town halls. Are we going to lead to a situation where they'll ultimately be discriminated against?
Go ahead.
Go ahead, Brad. No, you go ahead, Brad.
This is why it's important that all of us who can get vaccinated do get vaccinated, because that's how we protect those individuals who are not able to because of medical conditions. By having really high rates of vaccination, we can protect them because there won't be fuel for the outbreak when an imported case occurs. So regrettably, if they're not able to get vaccinated, they do need to greatly restrict their activities, and it's probably not smart to travel, and they should be really cautious about gathering, not just because they're not protected, but also because they're likely at high risk for severe outcomes from COVID.
Mm-hmm.
Yeah, I would just highlight also that, if somebody is not able to be vaccinated, which there are definitely people in that category, I would encourage everyone around them to get vaccinated in their bubble to help protect that person. And it's an interesting question, and probably the reason why the federal government is not yet going to make these vaccine passports, because exactly of these types of situations, not people that don't want the vaccine, but people who actually can't get the vaccine. And maybe at some point those people will be able to carry a doctor's note around, or maybe a doctor's card saying, they're not eligible to get the vaccine. I don't know, but we hope that there isn't discrimination against them, because there are definitely people who are unable to take the vaccine.
I think we'll also find that these immune certificates will have an alternative to vaccination, that you can demonstrate a test, either an antigen test within 6 hours or a PCR test within 3 days, to demonstrate that you're potentially eligible for attendance.
Mm-hmm. I think there's another interesting question sort of in the chat box, and we can comment maybe on it briefly, because I think it could be a topic on its own, certainly for someone like myself. But I do recognize the privilege we have here in the US, in first world countries, places like Israel, where there's the capacity and ability to have contracted and brought vaccines. And there is a disparity across the world in countries that do not have the means and the resources. And this person asked, will this not cause marginalization? And I personally fear that it will. And I don't want to put you on the spot, but would any of you like to comment on that? It's like,
yeah, definitely. So, we're really lucky in the US, and certainly places like Israel, where, vaccines are readily available to us, because there are many other countries where not only are vaccines unavailable, but the mRNA-based vaccines or the highly efficacious vaccines are not the ones that are available to them. So, so we're certainly lucky and should acknowledge that privilege that we have, and then also understand that because of the global nature of the world and global public health, if we don't vaccinate large swaths of the entire world population, we will continue to see variants, and we will continue to need to implement these infection prevention measures when these variants circulate in our communities. So it behooves us to ensure that the entire world population is able to get vaccinated. And so that's one of the things that we saw just in the last few days in India, as they enter this kind of monster wave in infections that they're seeing in that country. They're reaching out to the Biden administration, to the US, asking for help with vaccinations, because they need to vaccinate as many people in India as possible to get this surge under control. And so I think that's really important, and we need to acknowledge that we have privilege, but also that we need to make vaccine distribution more equitable across the world for all of our sakes.
And just one other added point there, surge is occurring in other countries where there's not as high vaccination rates are fuel for variant strains. We could reach a really high level of vaccination in the US, but if there's continued variants occurring in other parts of the globe, just because we're not as successful vaccinating, we're going to have reintroduction of variant strains here that could evade our immune protection. So it really is in our best interest to help get the world vaccinated.
So that, and I couldn't agree more, and it leads to that sort of question, like, help me understand the variants a little bit. So again, from two sides. One, a fully vaccinated person, what are my risks of I was vaccinated against one type of COVID, I'm sure. So when these variants are talked about, but what do variants mean? Like, you hear the Brazilian variant, South African variant, Indian, and I'm curious, like, I know something mutates, but I'm curious to hear more, so.
Brad, do we have slides on this?
I was just looking. I think I have one that shows how there's the variant strains emerging, but maybe we need to discuss just a little bit, how variants are occurring.
Sure. Yeah. I can start. So variants have been occurring thus far. You remember that the virus has a kind of a nucleocapsid, like a core, and then it has these spike proteins all around the outside, which I think many of us are well, well aware of what the virus looks like, because we see it all the time on the internet and different articles. So the spikes on the virus itself, the genetic code for the spikes end up mutating, and that's where we get the variants. For the spike protein itself has mutations in it. And so what we're doing with the vaccines is we are giving the body a genetic code for the spike protein, and then the body then develops antibodies and a T cell response in response to those spike proteins. So we're not actually seeing the actual SARS-CoV-2 virus when we get injected with a vaccine. So that's how the variants develop. And then what we're seeing in different parts of the world is obviously different types or number of mutations and different types of mutations, which is where we get the B117 strain, which is the one that originated in the UK and now is the predominant strain here in the US. That's how we find the B1351, which is a South African variant, which most of the vaccines have decreased efficacy towards, but are still somewhat efficacious. And then the P1 strain, which is the one in Brazil, which specifically looks like it doesn't. It's able to infect people that have been infected with the wild type strain earlier on, which is why Brazil is having such a problem now, because even in communities where infection was so common earlier in the pandemic, those same communities are being hit again by this P1 variant.
Because then if I bring this into sort of gatherings and coming together and stuff. And the first question that we had sort of received was like, after vaccination, how safe is it to socialize with other vaccinated people? And do you still need to wear a mask? And I heard you at the very beginning talk about like almost like this micro little groups that come together, like my in-laws and stuff, that we could be maskless. But now I'm hearing about the variants and I'm wondering, does it make more sense, because we're still learning and learning and learning, to actually be more cautious when we come together with other vaccinated people?
Right. So I think the CDC, yeah, this infographic from the CDC, I think is a really nice way to understand what our recommendations are. And so, you know, and this guidance came out now a few weeks ago. So this is probably everyone should have, maybe most people should have seen this infographic, but basically says that if you are a vaccinated person and you have a vaccinated household, then you are really free to interact with another vaccinated household without any prevention measures. And those are the green circles there, right? Now, if you are a vaccinated household and you want to interact with an unvaccinated household, where there are low risk people. So low risk, we mean people that are at low risk for having a severe outcome from the infection. You can still interact with them without any prevention measures. Where we start talking about implementing prevention measures is when you are vaccinated and want to interact with a household where there is a high risk unvaccinated person. And those are the orange circles that are clear in the center. In that situation, we would still recommend prevention measures. Again, masking, distancing, ventilation, hand hygiene. If you are thinking about 3 different households interacting where 2 of them are unvaccinated and are low risk, in that situation, you would still want to take prevention measures. So the CDC is basically saying in this guidance that 2 households could potentially consider interacting without any prevention measures. But when you get to 1 vaccinated household and multiple other unvaccinated households, that's when we still want people to take their prevention measures in general.
That's a great chart. I mean, it's a lot to absorb there. And I do always sort of worry that, 6 months time or a year later, we might all be revised. And they're like, oh, we should never have got together with people who are over 80 and not wearing a mask and stuff. And I think that's sort of, for me anyways, I'm sort of underlying sort of anxiety perhaps I have of socialization.
Yeah, no, and I think it's a really good point, Mark, that there is this psychological kind of stepwise implementation of people, even who are vaccinated, feeling comfortable going to eat in an indoor restaurant, right? Like people have to feel comfortable with doing something, recognize that this isn't, going to cause maybe an infection, and then maybe they can try that activity again. But I think what's important about this is the reason this. First of all, this was published in March of 2021, right? We essentially locked down a year before this infographic was published. There's no way that anyone at the CDC or anyone at any state health departments thought that we were going to be able to have this kind of guidance a year into the pandemic, because and the reason we have it is because these vaccines are that good at preventing hospitalization, death, and severe illness. So that's why we're even able to have these conversations right now.
Can I ask it just when you have this up?
Yeah.
And it was one of the other questions that we had got. You have those, say the top line there, 2 vaccinated families or adults over 16, but they both have kids who are under 16. Does that add, or am I just being like too cautious, or like should we be considering? I mean, obviously, from what I hear, people under the age of 16 do not get the illness, thankfully, too badly. And perhaps it's a milder version, and maybe that's a risk worth taking.
Right. No, I think Brad is the next slide. Does that help us with the conversations? Yeah. So just to finish up with, if you're fully vaccinated, you can visit inside a home or private setting without a mask, with other fully vaccinated people. You can visit inside a home without a mask with one household of unvaccinated people, but you should still not visit indoors without a mask with people at increased risk for severe illness, or attend a medium or large gathering. So we're still recommending smaller gatherings for vaccinated folks, not large gatherings. And I think your point is really essential. And a lot of us, I think, are grappling with this, where we have children that are not vaccinated. And so then it kind of muddies the picture a little bit, right? How can you interact? I think what has to happen in that situation, Mark, is you have to assess whether or not your children are at high risk for a poor outcome from COVID-19. So what does that mean? That means, do they have obesity? Do they have diabetes? Do they have uncontrolled asthma? These things would potentially be risk factors for kids, as we've talked about in earlier town halls, to have a poor outcome from the infection. But you're totally right. We are luckily seeing a lower rate of transmission in children under the age of 11, certainly, maybe slightly higher with the kids between the ages of 12 and 16, or 12 and 15. So that is something to consider. I think the fact that many of us do have kids that are in this in-between stage where their transmission rates might be a little higher than the young children. I think many of us are really still being quite cautious about how we interact with other families. I know Brad is in a pod with another family with kids, so that way the kids can interact together with each other freely, but not with large numbers of other families. And I think for us, in terms of travel, to bring this back to travel also, my assessment of travel for our family is that we are only going to be driving places. We are not going to be getting on an airplane because of the fact that we have children with us that are unvaccinated. And so I am not interested in traveling, across the country with my unvaccinated children quite yet.
Mm-hmm. I think it all does come down a little bit to where you get to your personal, it's what your willingness to take risk is. And I think that can't be dictated sometimes by others. It's a little bit of a family decision, as you say.
Absolutely.
I want to just sort of, again, back to the gatherings. This is something that came in, I probably answered a little bit, but I think it's an important question. Are there circumstances when a vaccinated person would be safe indoors in a public setting? So like we talk about these restaurants and stuff, and I have seen very crowded restaurants, or sort of other venues, large gatherings and stuff like that. Like, what is the public, like you don't know who's in the room with you. And I find restaurants, personally, a little sort of an odd one, and I haven't got back into I still find it very odd to eat inside. And so when I see a restaurant and I see tables very close together, the waiter's wearing a mask, but there's people like just in there, they're going to the bathroom. It's like there was never COVID. Right. And I wonder what the thought behind that is at the moment.
Yeah, so I think in general, when you're vaccinated, again, because you're protected from severe illness, hospitalization, and death, you can probably feel comfortable eating indoors in a restaurant that still you think is maintaining some infection prevention measures, right? You don't know if everybody in that restaurant is vaccinated or not. You have no idea. So in that situation, there are ways using harm reduction to make things feel more safe. Again, if you walk into the restaurant and you feel like people are not wearing masks, when waiters are coming towards them, or you see large groups of people maskless at a table, whatever makes you feel unsafe, you should feel comfortable to, leave the restaurant before you sit down. Number one. Number two, I think outdoors is probably still better than indoors because of the improved ventilation. I know in New York City, there are lots of restaurants that open their windows, right? So you have this great amount of ventilation. So you're maybe not actually sitting outside or inside, but you have that large amount of ventilation. I think that is really important. So having a well ventilated space is a good thing to have. Physical distancing is still important, especially indoors, to make sure you keep some distance between tables, consistent mask use, and especially we are still highly recommending mask use indoors when attending gatherings. especially with multiple people. Again, small gatherings are better than medium or large gatherings. And yeah, so I think restaurants are totally a possibility, especially if you are fully vaccinated and are eating with other people that are also have similar vaccination status to you.
And I will just add that the person who put the question in also just made a sort of a comment about their own experience of having been vaccinated and not eating inside, but meeting some friends and eating outside, and how wonderful it was to have that feeling normality again. And I think a lot of us, are feeling that. And I think that's where that sort of optimism sort of springs from. It is really nice to sort of return to some normality after, I think, 14 months of fear and also restrictions that have been sort of placed upon us. And I think that brings us over nicely to the topic of dating. And it's one that, can get and it's something else that has been very disruptive by the time of a pandemic. And I think, you could probably talk a little bit to some loneliness that people may have or have experienced. Before you share your slides, I do want to read, I heard two quotes on NPR, and I think it sort of sets it a little bit. That one was, "This is a freaking pandemic, so I don't see anything wrong with declining the date if the person you're talking to doesn't respect."
Mark's freezing up for me. I'm assuming he's freezing up for others.
Yeah, I thought I was freezing up. Chloe, are you able to see us still? I think, Brad, maybe you should just jump into your dating slides and then hopefully we'll get Mark back.
Sounds good. I'll do that. This has been a really isolating experience for many. And as mental health professionals, I'm sure you know very well that the data are demonstrating that, we're seeing 40% increases in adults reporting that they're struggling with mental health and substance abuse. It's really important for us to find ways to maintain social interaction and mitigate the risks of loneliness and isolation. And so we think it is a very good question to be asking and answering from a harm reduction perspective of how you can date and navigate social encounters while still minimizing your risk for COVID-19. So we do have some information to offer. First, obviously we all know at this point that SARS-CoV-2 is primarily transmitted through respiratory droplets and more rarely through airborne transmission of the smaller respiratory droplets. But there's also been a fair amount of work to look and see what other kinds of bodily fluids can potentially support transmission. You can transmit COVID-2 via saliva, and so close conversations or kissing can definitely be a means of transmission. They've done lab studies to demonstrate that you can detect the virus in semen and stool, but not in vaginal fluids. So while there's no evidence that it can be transmitted vaginally or through anal intercourse, this really hasn't been well studied, and I think we'll need more data to know that definitively. You may have heard through discussions about things like wastewater sampling that, people who have COVID-19 do shed the virus in their stool about, a little more than 50% of the time. And so definitely many people are recommending that you should avoid anal sex or other sexual behaviors that could put you in contact with stool because of a risk of transmission. We're trying to break this up into sort of higher risk and lower risk activities. Higher risk, certainly in-person interactions, especially if it's somebody who's potentially been exposed to another person in the last 14 days who could have COVID. As we've talked about for gatherings, it's higher risk to date in a small or indoor or crowded setting, especially if there's dining or drinking involved. Substance use, alcohol or drugs could lower inhibitions, and I think we're seeing this in bars. Results in poorer compliance with protective measures. This has led many states to put curfews in place for restaurants and bars, because as the night goes on, it seems like the compliance with protective measures dwindles more. Safer to use non-physical methods of contact, use that Zoom or the online chat. Consider in-person venues that are outdoors or have real large spaces with enhanced ventilation and filtration. As a family, just for our family activities, we're learning those indoor venues that are large or are more well ventilated as opposed to the ones that are small. Stay masked and use good hand hygiene, which is a principle that we've been recommending consistently here. Get into a relationship and things are becoming more intimate. There's some higher risk activities and some safer ones. Obviously, unmasked conversations where you're close or kissing, sexual intercourse would place you at higher risk, especially if you don't know whether that partner potentially has COVID or has been exposed to somebody who has COVID recently. Safer activities would be ones that are remote. Mutual masturbation, maintaining intimacy without the risk of transmission. There's actually a lot of information on the internet about ways to do this. Obviously, the most protective is that you become fully vaccinated yourself and consider only dating others who have a similar mindset and are able to become fully vaccinated. That's the one way that you can truly date in the safest manner. And it might be worthwhile when you're still first meeting folks, prior to having that in-person date, if you're not fully vaccinated, agree to get a negative test beforehand, agree to quarantine beforehand, or at least limit your interactions. That's the way that you could truly date in the pandemic with maximum protection.
So with that, and sorry, my video went for a minute, but so not sure you heard my quotes, but COVID talks. I've heard this term being bandied around that people now have a COVID talk with someone, and is it appropriate to ask someone like the status of their COVID status or their pandemic lifestyle, as someone put it? Like, is a person all out there meeting loads of different people, dating loads of different people? Have you heard of that expression before, and sort of and what it means? And
yeah, I don't think it's that different from what we've recommended for HIV and sexually transmitted infections for a long time. It might happen a little bit sooner in the relationship, but at the point of potentially being in a relationship where there's the potential for intimacy, to talk about whether or not your partner has been tested negative for HIV and other STIs is really important. And I think it's in that vein that there's recommendations to have that quote unquote COVID talk with somebody early in the relationship and see if they share your same views as far as desire to be fully vaccinated or maintain, protective measures.
I'm just going to encourage people again to put questions in the Q&A as we go through this, so we can add them in if there's something you would like to add to Brad or to Dr. Trivedi. One thing you mentioned there, Brad, was about testing, the ability, like if I was going on a date with someone, perhaps to both get tested before. But like if we both did rapid tests, like is that really a good sign that we're both COVID free?
Well, there's certainly some tests that are more sensitive than others. If you're symptom free, I think an antigen rapid test is better than no test at all. If you're able to get a PCR test within 72 hours of the in-person encounter, that's even better. But we also understand that cost and your ability to access and get a test in the right time frame are also important measures to make this a feasible recommendation.
Yeah, and I would just add to that isolating for a few days and then getting tested is also more able to show your true viral status, as opposed to getting tested like the morning of and not having made any changes in your activities the days before. But I think the symptom screening is especially important, right? If you have a cough, if you have a fever, you want to cancel that date and not go through with it. Again, that aborting the mission because you are now potentially symptomatic and could be potentially harboring the virus. So I think it's kind of a way to jumpstart the relationship, right? Because you get to have these very kind of deep conversations at the very beginning of what you're starting, and you immediately see if you match with the person that you're starting the relationship with.
Mm-hmm.
I have a daughter who I hopefully won't see this shared, but she's dating age, and she said recently, Dad, he's not going to make the cut because he doesn't share my desire to be fully vaccinated, and I understand he was at a recent venue where he wasn't masking, and I think that's great. That's exactly what we hope young people are thinking.
And there was, I mean, something that I'd read sort of on NPR was at the beginning or around this time sort of last year, New York City health officials, being aware of desire and support, they were encouraging people to wear masks if they were going to become have sexual encounters, casual sexual encounters, where you were unsure if a person was vaccinated or not. And again, this back in the sort of early days of the pandemic. Do you think that is still a recommendation that people would make?
Sure. I think masks aren't perfect. So if you're going to be around somebody continually for long periods of time, it can only do so much. But I think in a date of short duration, and there's going to be the potential for a sexual encounter, and that you don't know whether they're fully vaccinated or not. I think masks or some kind of respiratory protection can help.
I was wondering again if actually just a little bit more about sort of studies, like people love to study different areas, and this is one area of the pandemic. I'm wondering if people have studied to see if there's been sort of any impact on relationships and the way that relationships occur and stuff like that you know of.
I have not seen studies that have looked at that. Besides just the impact that the pandemic is having on isolation and difficulty with intimacies, I haven't seen specific studies in that area.
But I think that, like Brad said, it's really clear that obviously the pandemic has isolated folks. And so if people are in places that have low transmission of the virus, trying to figure out ways to interact with people and make those connections and, kind of get back to our own humanity, I think is really important for people to really think through. I think, is it New York State Health Department or different groups have put out individual assessments that you can do to determine kind of what your COVID boundaries are. And you could potentially ask a possible partner or possible dating partner if they would fill out a similar assessment, and then you can compare and contrast and see if you match, quote unquote, on your COVID-19 approach or not. So I think that there are resources out there to help people have these conversations, guide these conversations. And I would say that we are in the part of the pandemic where we want people to not be isolated and try to reach out and figure out what feels good in terms of how we can interact with one another.
And I think something more so, like even go away from dating a little bit to full-on relationships. It'd be interesting to see, like, over the course of this pandemic, people have been living in much closer quarters, and maybe relationships where they've been a strain before is placing an extra strain, or some relationships become stronger. And it'd be interesting to see if there's fallout post-pandemic, or that when we look back on it, that there's been an increase in separations, or God forbid, but I've heard potentially an increase in domestic violence too. So.
I have seen some reports of that, of social or other conditions being exacerbated. I think there's some indication in Kenya of an increase in unplanned pregnancies. Definitely seen reports of increased domestic violence and intimate partner violence associated with some of these community mitigation measures that we take to shut things down.
So you mentioned sort of the unplanned pregnancies, and I'd wonder if it may have gone the other way, especially in the sort of the first panic months, if I'll call them, it's like of last year, if people were really sort of homebound so much more, and that there may have been less unexpected pregnancies.
I didn't see any data in the U.S., so I mean, I think that's an open question, unless Kavita, you've seen anything.
No, I just wanted to comment about the domestic violence question. I think we have seen an increase in domestic violence, especially with children all across the country and world. And so that was, I think, another impetus in trying to get schools open because children are safer in school. And I think also, the pressures of the pandemic on parents and families, the economics have really kind of exacerbated the number of children that have needed to seek emergency room kind of care due to the trauma that they've induced at home. So domestic violence is definitely on the rise.
It's such a shame. It's one of those sort of effects of a pandemic that you don't necessarily think of when we think so much just around the health and the illness itself, but there's so many sort of knock-on effects that we see across the city and the country and in all communities too. It's not in any ways limited, I would say, to any particular community.
And let me just make one other comment, Mark, that there is a kind of a movement right now within the infectious disease world in places where transmission rates are low to eliminate outdoor mask use completely. And one of the reasons for this is that because we know outdoor, the risks of contracting COVID-19 outdoors is so exceedingly low. I mean, it's 19 to 20 times lower than if you're indoors. So there's some people that are saying that we should just get rid of outdoor masks completely. And I think that would also open up people to feel more comfortable interacting with one another, with people from other households at an outdoor, restaurant, outdoor venue. So just something that we might be seeing in the coming months.
And you are seeing, right, in Texas and places that masks are no longer required. And I think we've talked before, and maybe it was even on last month's call, about not necessarily a huge spike in cases in Texas where people aren't wearing masks. And I'm just wondering if that's like, someone had said to me, maybe we had talked about it, but perhaps some of the reason in Texas is because their initial drive vaccination was all ages, and they actually sort of vaccinating younger people in their 20s, 30s, and 40s at the same time as their seniors. And in that way, it sort of cut off the spread, if you will, if we say it's spreading more in younger folks.
Unfortunately, we've seen some jurisdictions begin to relax some of those protective measures, even in the midst of a surge, which is always concerning. So, regardless of what the recommendations are in your given state, if you're not protected, we're hoping that if you're not protected with the vaccination, we're hoping that you especially consider some of these measures to reduce your risk.
Mm-hmm. I just want to end on actually just go back. I missed two questions sort of in travel, if you don't mind. One is probably a very quick answer. Hotel versus Airbnb, that if you do travel, is one safer than the other?
I think an Airbnb would probably be safer, only because you're better able to isolate within your own household and you have less risk for interaction with people in general, especially people who are maybe coming from different parts of the country or world.
Yeah, and I think that actually kind of highlights your question earlier, Mark, about traveling from New York to Florida, right? What's a safer airplane or car? I think, you can do it safely, probably both ways, but by car, if you have Airbnbs along the way, if you make sure to only eat at outdoor venues, I think there are safer ways to do it. But I would just take into account the risk of getting into a car accident, which is not zero, and the risk of having an airplane accident would be much lower. So again, I think this is a good way to remind us to reassess the risk that we take every single day getting into a car versus maybe taking a vaccination, which has a really, really low rate of clotting complication, right? We have to take all these risks and understand that we are willing to take some, and somehow we are more nervous about taking others, maybe newer ones.
And I think there was actually a New York Times article about that. Like, we stopped the J&J or pause it for 7, and unfortunately one death, but roughly 100 Americans die a day. in road accidents, and yet we don't stop, obviously, using our cars and stuff, and just that question of risk in a way. And I think I just want to end on the impact I associate with the pandemic. It's a psychological, like even that fact that we have been a nation of huggers, say pre-COVID, and now the idea of shaking hands with someone, hugging someone, feels incredibly alien, and what impact long-term this has had on our sort of our psyches, and I'm assuming will turn quickly, but it's just like, for me, like I'm not ready to sort of necessarily hug someone, even if you're vaccinated or not. So
I think one of the things that's going to endure post-pandemic is you know, a change in the way that we greet. You know, I think hugs and handshakes are going to be replaced with other forms of greeting. You know, even if you take aside COVID, handshakes certainly help facilitate the spread of things like flu, other respiratory and other pathogens. You know, so we can find ways of showing respect and greeting people and being very attentive and loving without hugging and handshaking people who are not in our household.
Right. And then this lastly, and I think Dr. Kavita might be actually typing an answer to it in a way, and it ties back a little bit to vaccines. Like the person in the box is asking a little bit about how long will we have to maintain precautions and the precautions of masks and social distancing. And that sort of weighs up a little bit with an earlier question of like, do we need a top up of our vaccines? And yet no one knows necessarily the answer. And so are we in this for the long haul of maintaining precautions and having to get yearly vaccinations? Do we know?
Go ahead, Brad. I answered his question in the chat, so why don't you answer it?
Oh, okay,
live?
I'm sorry. Yeah, I wanted to bring up a slide about breakthrough infections because many people have been wondering about this data that the CDC published last week. You know, unfortunately, I think the way that some of the media stories here portrayed the situation were a little bit alarmist. You know, 5,814 individuals who are fully vaccinated have had COVID. You know, it was actually, for those of us in public health, it was great news. Because, you know, the context here is that we vaccinated more than 75 million people in the US, and to date, we've only seen 0.008% experience breakthrough infections. You know, and so if you remember, we've been talking about the vaccine being highly effective at preventing hospitalization and death, and 94 to 95% effective at preventing mild infection. So it's not perfect. We do expect there to be some individuals who have mild infection. And so CDC's been asking state and local health departments to track these quote unquote breakthrough infections more as a way to make sure that the real world effectiveness that we expect to occur is actually occurring, right? And it is. That's the good news. You know, largely for people who are vaccinated through Pfizer and Moderna, we are seeing the level of effectiveness we thought we would. It's important to point out that breakthrough infections can happen sometimes just while we're in the midst of getting the 2-dose series, where we don't have complete full protection, and you know, that's really maybe not even a breakthrough infection. There's some evidence preliminarily that, like flu, when you've been vaccinated and you're still end up getting infected, it's less severe. That would be great news as well, because it you know, would suggest that even these breakthrough infections offer some protection. And to date, the vaccines that we're receiving in the US all appear to be effective also against variants. But you know, over time, we will see variants begin to cause some of these vaccine breakthrough cases. And I think obviously the vaccine manufacturers are watching this closely as they contemplate whether or not they'll be making changes to the virus proteins that their vaccines protect against, and also while public health experts make recommendations about whether or not a booster dose is needed and when it's needed.
Right. I don't see any more questions in the box, and we're coming close on time. So unless you guys have any last comments you'd like to make.
Well, I'll just say that somebody asked a question about, I think she asked a question a couple of times about when are we going to be able to get rid of the precautions? And, I think the answer is it depends on vaccination status amongst, our communities. Like I said, in Israel, we are seeing that when you get to 60% vaccination, you're seeing this incredibly steep drop off in hospitalizations and deaths. And so that's what we want to see. That's what we want to see in Michigan. That's what we want to see in Florida, and other states that are having surges right now. And so I think that we could see, depending on vaccinations, we could see lifting mask mandates and other infection prevention measures even as early as this summer. I think it also depends on, when the 12 to 15-year-olds are approved to receive the Pfizer vaccine, which may be as early as May. So, it really all depends, but we do foresee a time in the near future where we can take off our masks and interact in somewhat more normal ways. And I would encourage you to think about what that looks like for you. I have one client that keeps telling me that hand hygiene is here forever. Like hand sanitizers are going to be all over the place all the time. That's one thing that we will continue seeing. I think other things to consider are, when are you going to need to put your mask on again? Maybe your mask goes on anytime you go into an indoor venue where there are lots of different people. Maybe every time you get onto an airplane from now on, you think you feel more comfortable wearing a mask. So, regardless of when that ends up being, I think it's important for us to figure out what makes us feel comfortable and what we have learned out of this pandemic, what feels okay to us, and what makes us feel protected in certain, settings and scenarios.
Mm-hmm. And I think there's some normality to the mask now too, that I see people now and I don't blink when I see them in a park or something wearing a mask, or and I think the subway is another example. And I think there's probably, maybe I'm wrong, a percentage population that see a benefit. Like I had a friend who goes, like, we had no colds this winter, we had no flu, they haven't been sick as a family. And part of that perhaps being wearing masks when they are out and about. So
I think we're gonna get much more adept at switching them on and off, right? You're gonna find that when you visit a loved one in a nursing home, you're gonna put all these protective measures in place. And maybe when there's an alert issued for my community because transmission has increased because of an imported case that's leading to an outbreak, we're going to switch on these measures and be more diligent about it. But I think that's what's going to happen is we'll get better at switching them on and off.
Right. And that's, I think, a positive note to end on. And I just, once again, Dr. Trivedi and Brad, thank you so much for your time. We do appreciate you joining us and sharing your knowledge and conversation. It's always an interesting one. And thank you to those who participated via questions or just being here today. But your questions certainly help, and some send them in to me beforehand and some during it. And as we roll out with our 5th town hall next month, we will encourage you to send questions in advance as well. So thank you very much, and enjoy the rest of your day. Stay safe.
Thanks, everyone.
Thanks.
Bye.
Bye.